Metatarsalgia. Metatarsalgia is a condition that causes pain in the undersurface of your foot at the base of the toes, usually in the area of the second and third toes, shown here on the model. Sometimes it's called stone bruise due to the specific clinical presentation. It is due to partial or complete collapse of the transverse arch formed by the metatarsal heads, which are the bases of the toes, as seen here on the model. Collapse of the transverse arch. Causes and risk factors for metatarsalgia. Different things can cause metatarsalgia. It can happen when people run or do other activities that put a lot of pressure on the feet. It can also happen in people who wear tight-fitting shoes or have certain foot problems. Congenital abnormalities affecting the foot or ankle, or abnormal foot anatomy, like having high arches or second toe longer than the big toe, can also cause metatarsalgia. The clinical complaint of metatarsalgia. Patients with metatarsalgia complain of sharp pain on the undersurface called the plantar surface of the foot, in the area of the base of the toes. The second and third metatarsal heads, or the bases of the toes, are the most common location of the pain, as seen here on the model. The pain is often described as feeling like stepping on a stone. The pain is relieved by sitting or sometimes when wearing shoes that offer forefoot support. Barefoot walking increases the discomfort. Dorsal pain on the upper part of the foot occurs more often with stress fracture, discussed in one of the other videos, and is not typical of metatarsalgia. Making the diagnosis of metatarsalgia. At the doctor's office, you'll be asked different details regarding the clinical complaints, about your lifestyle and activity level. The examination will be performed while sitting and while standing. In certain clinics, the medical examination will include gait analysis, which will be done on a treadmill. Imaging tests such as an X-ray, an MRI, or an ultrasound will be ordered to see whether there are any bone fractures or any other possible clinical entities that can mimic metatarsalgia. The treatment for metatarsalgia. Treatment usually involves one or more of the following. Resting your foot. Give your foot a chance to heal by resting. You can do activities that put less pressure on your feet, such as swimming. Putting ice on your foot when it hurts or after activities. You can put a cold gel pack or a bag of ice or maybe even a bag of frozen vegetables on the painful area every 1 to 2 hours for 50 minutes each time. Put a thin towel between the ice and your skin. Taking anti-inflammatory drugs such as acetaminophen, Tylenol, or ibuprofen, Advil, or even naproxen, Aleve, could help with reducing the pain. Wearing sturdy shoes and a metatarsal insert. Use sneakers with a lot of cushioning and a good arch and heel support. A padded insert called a metatarsal pad is highly recommended, placing it into your shoe. In most cases, these treatments help you with the symptoms, but if the symptoms does not resolve, your doctor might talk to you about other options, This might involve surgery to correct the position of your foot bones.